Welcome to In Your Prime. I'm Jana Collier, publisher of the Dayton Daily News, the Springfield News-Sun, and the Journal News. I'm so glad you're joining us today for this important and interesting discussion. We're going to be talking to local experts about staying healthy, managing our finances, and most of all, living our best lives now in our prime. I am pleased to introduce Rafi Rodriguez, the president of Rodriguez Financial Strategies, LLC. After completing his successful military service, Rafi began his career as a financial advisor in 2004. He specializes in retirement planning, especially for military retirees and business owners. Welcome, Rafi.
Thank you.
So tell me a little bit about why you're so passionate about helping people plan for retirement.
Glad to, Jana. I believe in my heart that guiding others to find and follow the true financial north is my God-given talent. All throughout my professional life, I've advised many people on the actions they need to take with the deepest conviction to help them. And for me, this financial profession is not a job, but a true calling.
So that's so great, and that's so important because retirement is a huge part of people's lives. By 2024, almost a quarter of the people in the labor force are going to be retirement age. And it's no wonder then that retirement is on so many of our minds. And while it's exciting to think about retiring, it also can be really frightening and unsettling. It's one of the biggest decisions that we make in life. So from your expertise, what are some of the challenges and risks that retirees may face in retirement?
Well, you're absolutely right, Jana. This is probably one of the most difficult decisions people will face. And there's some challenges and risks that we need to be aware of. One of them is longevity, living a long life, the rising cost of healthcare, for example, as well as the market volatility, which is the market going up and down, inflation, which we've been facing that here recently, public policy changes where the government makes some changes to benefits that could impact us. And one of the most important is probably the inadequate sources of income to enjoy your retirement and the desired lifestyle that we want in that retirement.
And when you think about that, which of those things are the most important?
Well, to answer this question, we kind of need to identify which one of these risks we have control over and which ones we do not. For example, some of these risks that we do not have any control is, for example, inflation, as well as healthcare cost. Public policy can make a positive or negative impact on our finances, but the changes may not be realized until that legislation becomes a law. On the other hand, we could have some control over some of these, like longevity. We could plan for longevity, the sources of income, which monies are we going to use for retirement, and market volatilities, since these are actually interrelated. And to manage longevity, we need to ensure that the combined income from investments, passive income, pensions, and Social Security stay ahead of inflation and last beyond our own lifespan.
That really makes sense then, to focus on the aspects of retirement that we can control and worry less about what we can't control. You know, the average American is going to spend 20 or more years in retirement. And, you know, one thing that you said that really stuck out to me was the need to make sure we have enough income to last throughout all those years, potentially decades. We want our income to basically kind of outlive us. But how do we actually do that?
Well, this is a really serious question because we need to figure out how to manage this risk, especially when you're talking about the challenges of healthcare costs. One of the ways to mitigate this risk is potentially having a strategy to ensure that the long-term care costs do not deplete the assets and the income that you have set aside for the retirement lifestyle that you want. And in the case of a long-term care policy, it could be a way to protect the assets and the income, and can cover the care such as a chronic medical condition, disability, or a disorder such as Alzheimer's.
Mhm.
So you can see that's on the healthcare costs that we need to mitigate, including the long-term care. But in tandem with that long-term care strategy, you should develop like an integrated retirement income strategy that allows for all the fixed income that you'll be receiving, whether it's a pension, passive income, Social Security, etc., plus a diversified investment portfolio to provide for the income needs in every stage in retirement. For example, there's a strategy called the bucket strategy, where the portfolio has three segments. One, which is a conservative sector for immediate income, which typically lasts up to 5 years. That is followed by a growth and income sector for needs 5 to 16, 17 years in the future, and a growth sector for typically over 15 years. And this particular bucket strategy considers inflation throughout retirement.
Right. I'm glad that you mentioned long-term care. According to research, 70% of Americans over the age of 65 are going to need some kind of long-term care. And yet so many people are just completely unprepared for the costs associated with it. Can you talk more about when and how we can prepare for those long-term care issues?
Yeah, that is a big question. And long-term care costs are an important part of any financial plan. I call it the missing puzzle piece of your retirement plan. Without a plan, you're counting on all your lifelong savings and assets to be used to pay for quality care services versus the lifestyle that you wanted. I'm going to give you some statistics here. For example, in the case of care for quality skilled care facility in Ohio exceeds $100,000 a year for a private room. On the assisted living setting, it's over $60,000 a year. And for home care is about $50,000 a year. As you can see, it will not take long to deplete your retirement plan or to impact your retirement plan. Another thing that we need to consider is when is the best time to look at long-term care as a way to mitigate some of this cost. The best time to even consider a long-term care plan, it's in your mid-60s to mid-60s. And the reason for that is a lot of the major expenses are already out of the way, such as college expenses for the kids, weddings, and so forth. And there are many options out there in the market for long-term care. This is when I really recommend to work with a long-term care specialist so that he or she can develop a plan based on your budget and your needs.
Gotcha. So, Rafi, what's the number one issue that you see among people who are considering retirement?
Well, in my experience, the number one issue is running out of money in retirement, as we alluded earlier. And it is so important to meet with a retirement income specialist to assess your retirement income needs, the lifestyle that you want in retirement, and take a look at the assets available to do that. And some clients have saved many quantities of money for the lifestyle that they want. But on the other side of the spectrum, there are many that would have to work in retirement because they did not save enough.
Right. Now, I know that you're a retired colonel in the Air Force and that you work with a lot of veterans and military personnel. Are there any specific issues or concerns that our veterans should consider when they're thinking about retirement?
Well, a common issue I have experienced is that many veterans want to work with a financial professional that understands their military benefits, which is not common knowledge unless you have served in the armed forces. And just so you know, only about 1% of the American population ever serves in the military. So that's a really small number. So when planning for retirement, it is always a good idea for veterans to seek a financial professional that is familiar with the military benefits and understand their needs. In other words, the financial professional has been there and done that.
So how do people find the right person to help them with these kinds of retirement plans? And how do they know that the person they're dealing with is someone they can really trust and has their best interests?
Well, that's a good question. I think that one way to start is sometimes people have this water cooler conversation at work. That could be one source. Most important, go to a website and start looking for financial advisors that do retirement planning. But the most important aspect when you're searching for a professional is, are these professionals a fiduciary? A fiduciary is a financial advisor that whatever they do is for the interest, first and foremost, of the client, not themselves. And that's a key right now, to find a fiduciary advisor. And that's what we do in our practice, for example. But there's plenty of sources out there, whether you're in the federal government or you are looking for somebody in industry, just search financial advisor near me. But always look at their website and try to find out if they're a true fiduciary, someone that will work on your best interest first and foremost.
Right. Well, that's great advice. Now, our readers do have questions too about their retirement savings. Here's what one of our readers asked. I will have a pension when I retire. Is it better to choose a monthly check or to get a lump sum payment?
You know, Jana, that's a great question. And the answer is, it depends on your situation, because as an advisor, you need to have a very clear picture of what are the income and budget needs for that individual, as well as the objective of the lump sum dollars versus a monthly pension check. So that's we just cannot give a generic advice on that one. In addition, just as important, that individual needs to consult with your tax advisor to assess any tax consequences on either option. And in my case, I do not offer tax services or tax advice. So, maybe an accountant or a CPA can best answer the tax question.
Gotcha. That's good. Thank you. So thank you so much for sharing your advice with us today. But before we move on to the next segment, is there anything else that we haven't covered that you think is just really important for our viewers to know?
Well, most important, that retirement planning can be complicated depending on your situation, the age you want to retire, the benefits that you're looking at, and it's really wise to work with a qualified financial professional to guide those in retirement and soon to be retirees throughout the financial journey in retirement. The main thing is look ahead, plan ahead of time. Don't wait until, hey, I'm retiring next week. What should I do? This is something that you should be looking at potentially 5 years out, 10 years out, 1 year out as you get closer, and work with somebody that will walk you by the hand so that you could make the best decisions for the reasons that are important to you. It is so important. So many people come to my office or look for a financial advisor way too soon as they face retirement. Retirement is not a one-time decision. This is a decision that you should be planning for, because it's not just about income. You have to take a look at healthcare benefits. When do you integrate the income with Social Security benefits? There's ways to optimize Social Security as well as your investments. And what is the right strategy? Do we need to consider, do we have the right life insurance to protect our loved ones in case we depart too early? Also, part of the retirement planning is certainly estate planning, where we need to bring the estate planning attorney to figure out what is our legacy when we leave planet Earth. So there's many, many, many decisions that have to be taken into consideration when you retire. How do you identify the assets? Should they be under a trust? Do you have a will? That's why the first bullet I mentioned is retirement planning can be very complicated, and there's many people that come into the into your team, like your financial advisor, your insurance expert, could be the same person, but it could be somebody else, your estate planning attorney, your CPA or your accountant, and many other people that are in your circle of influence, even in your faith. Is there something that you want to leave as a legacy going forward through your faith? So many aspects. Retirement planning, it's a stage in life where we've never been to. We know people that have been there, but when it's our turn, it's almost like riding a roller coaster. Somebody told me how it feels. Yeah, until I have to go through it myself. And then I realize, oh my God, this could be a ride. Not to keep it lightly, but it's a unique situation where we need to be ready for.
Yeah, I can totally see that. And it's something we're all going to face, and yet it's unique for every one of us.
Jana, one thing I share with a lot of my clients is you plan, then there's life. But it's easier to adjust a plan than always have a knee-jerk reaction, to life events. But if you have a plan, you may be able to adjust and mitigate it much easier than not having anything and then go through crisis management. And it is better to have a plan.
Absolutely. That's great advice. Thank you. Next up, we're talking to Dr. Rachel June. Dr. June practices geriatric medicine and provides primary care at Kettering Health. She specializes in care for dementia and planning for advanced care and chronic disease management. So welcome, Dr. June.
Thank you so much for having me. I'm excited to be here with you this afternoon.
So I know that you specialize in dementia care and geriatric care, but I also know that you're not just an expert, you are a compassionate physician who really cares about helping older adults. So how did you get interested in this, and how do you see the field changing?
Well, when I went into medical school, I didn't even know that geriatrics was an option for a field, as I think a lot of people that I'm seeing as patients didn't know this existed. I was partnered up with a geriatrician as a mentor, and just professionally and personally saw what a difference his care made. He ended up being the primary care provider for my grandparents. And I saw a different style. He focused on things that were important to them at that age and really talked about difficult topics, things that they were struggling with as they got older. And he helped walk not only them through it, but also my whole family. And so it just made a big difference and definitely was the reason why I pursued geriatrics.
That's great. So there are a lot of things that we worry about as we get older, but one of the biggest concerns people have about aging is what happens to their mind. So how prevalent is dementia, and why do we get it?
Dementia, unfortunately, is very prevalent. You'd be hard pressed to find somebody who hasn't been affected by it in a family member or friend. There's about 6 million cases of Alzheimer's in the United States each year. And so why we get it is still a question. We know that as we get older, your risk increases. So we know risk factors for dementia, things like previous brain injuries from sports or motor vehicle accidents, exposures such as drugs or alcohol or smoking, poor sleep. There's a lot of different things that can put you at risk for having dementia, but we can never accurately predict why would one person get it over another. So the best thing we can do is help limit those risk factors.
Right. So everyone has these things that we jokingly call senior moments, even people who are not seniors. And yet those memory lapses can really be very concerning. Help us understand the difference between, that normal kind of experience and dementia.
So I like to grade the memory changes in 3 different ways. One being normal cognitive aging, one mild cognitive impairment, and then dementia. So we kind of have three different categories. That normal aging is just what you described, those senior moments. I know somebody's name, it's on the tip of my tongue, or I know why I went into this room and it's aggravating and it comes back to you later. So if it's something that comes back later and it's maybe just taking some time to trigger that memory or that word in your brain, that's pretty normal. You're still able to learn new tasks, retain new information. It may just take things a little bit longer. When we get into mild cognitive impairment and dementia, we're seeing that memory deficit is more significant. If we were to give somebody a memory test or words to remember, their score would not be within a normal range. And so that being said, it's important to have these cutoffs and different scoring systems so we can kind of determine what a patient might think is concerning versus what really clinically we're finding problems with. When we start to call it dementia is when we actually see it impacting function. So mild cognitive impairment doesn't have any impact on function. You are just having more memory lapses, but you're managing everything on your own. And then once you get into dementia, there really is an impact on the function. And there's a huge range there too on function. As you can think of, if you've met somebody with dementia, it might be not being able to balance my checkbook or needing someone to take my medications over versus feeding, dressing, bathing, that the spectrum of functional decline and changes varies greatly depending on the stage of the disease.
Right. And a lot of people don't really realize that they can actually get help if they're experiencing these memory issues. So what should someone do if they think that a loved one or maybe themselves has a memory problem? And what kind of help is actually possible today right here in our area?
So the first thing I would recommend is if they recognize the problem, schedule an appointment with their primary care doctor. So make the visit just for memory concerns. Don't go in for something else and say, oh, by the way, I have a memory problem. This really needs to be the focus so that a dedicated amount of time can be on it. And there are different resources. I mean, your doctor is probably your primary source to start, but there are support groups throughout the community for people living with memory problems. Alzheimer's.org, the Alzheimer's Association has a local chapter. The Area Agency on Aging can help provide support. So really, the resources are endless. You just need to know who to be linked up with.
And what should someone expect when they're going to have that office visit to evaluate their memory concerns?
So it's really intimidating, I think, for people because they're worried about what are we going to find. And so I always like to reassure people, this is a visit. We're really just talking. We're not poking, prodding much. We're going to be talking about what changes have you noticed? And so a lot of questions going into the history. When did this start? What did you first start noticing? Is it changing? Has it been gradual? Is it progressive? Have things gotten better? Have they gotten worse? I always like to recommend, if possible, that you bring a trusted companion, family member with you to this visit, because sometimes they might pick up on something that you didn't in the visit. And they're also a good source of information to your provider. They are able to see and present on what they've noticed has changed. So it's helpful to have somebody else there for these visits.
Right.
Once that information gathering has occurred, some type of cognitive test would be performed. And there are multiple different cognitive tests, but usually they present with giving some words, something to remember, giving you another task to complete and asking if you remember those words, and questions about orientation, the date, the month, the year, where are we right now? Maybe some tasks like drawing a clock or making a trail, just to see how different areas of the brain are functioning. So that's usually the office visit. And depending on what's found in that visit, the provider might decide to get some blood work or head imaging after that.
Got it. Now, we all want to stay mentally well. but it's just not always as obvious, I think, how we keep a healthy brain as it is to keep a healthy body. So what can we do to actually maintain our brain health?
So anything that's good for your heart is actually good for your brain too. So if you think about the heart needing good blood flow, so does your brain. It needs good blood supply from your blood vessels to be working. So avoiding things like smoking, avoiding things like alcohol. Exercise is certainly a good thing, physical exercise in any way, as well as staying engaged, whether that's conversations with others, engaged in reading, debate, doing puzzles, something that you like to do. So there's not one way to be cognitively engaged. And we're certainly seeing that more with the pandemic right now. As people have been isolated and away from their activities, they're noticing more decline in their memory. And it just shows us how important that is to stay mentally active. And I think I mentioned before too, sleep is really important for your brain. And so making sure you're getting a good amount of sleep and high quality sleep. And so if you are waking up feeling really exhausted, you probably should get that evaluated, because that's something that could certainly help your brain health as well.
Great. That's really good advice. So let's see what questions our readers have. And there's one that's really a good follow-up to what you just said, which is, here's the question: is it true that doing crossword puzzles or jigsaw puzzles helps keep your brain fresh?
So it certainly is good to be involved and do some type of activity. There's no evidence that says one activity is better than another. So if you like Sudoku puzzles, or if you like doing those crossword puzzles, certainly do it. If you want to read a book or a newspaper, do that. Any way you can stay mentally active is definitely good for your brain.
Great. Well, thank you so much for sharing these important insights with us today. If you could leave our viewers with just one thing to focus on about dementia and brain health, what would that be?
Really look at your brain as a holistic approach. The best way to have good brain health is by staying healthy physically, mentally, spiritually, emotionally. Making sure all of that is well cared for will help you maintain good brain health.
But are there other factors or things that we should consider or look at when we're thinking about our brain health?
Certainly. So during those visits, when you come in to see your provider, they're also going to be asking about your mood, because anxiety and depression can sometimes present like dementia. It's hard to remember things or focus on things when you're going through a difficult period in your life. So your doctor should screen for those concerns and treat those conditions if they find them. And it's also important that you bring a list of your medications to that appointment, as well as any over-the-counter supplements. Sometimes over-the-counter allergy medications or sleeping medications may be making you more confused or tired and could be causing some of the confusion.
Great information. I think people are really going to appreciate it a lot.
Wonderful. Great. Thank you so much. I appreciate it.
Thank you to Dr. June for joining us today. You're watching In Your Prime. This program is sponsored in part by Kettering Health.
Being a good listener makes for better primary care. At Kettering Health, our providers take the time to get to know you and your unique needs. Our best in primary care, powering you to be your best. Kettering Health.
Thank you to our sponsors, Kettering Health, Medicare Resource Center, and Ask Rafi Retirement Lifestyle Solutions. Now we're going to turn our attention to Medicare. It's a subject that can seem daunting, but we have Kate Johnson here to guide us. Kate is a licensed Medicare insurance agent and the Vice President of Medicare Resource Center. She's active in her community and passionate in her work, where she helps people understand their healthcare options. So hi, Kate. We are so happy to have you join us today on In Your Prime. Deciding to enroll in Medicare is a huge decision for folks, and then really making sure that you're getting the most out of it is critically important. I know that's your passion, helping people understand and make the right decisions for themselves. What are the most important things that someone should consider as they become eligible for Medicare?
That's a great question, Jana. And age 65 comes and we're looking at all kinds of different things. Do we retire? Do we keep working? Do we consider a second home? How are we going to live on what we've saved? And your healthcare, of course, is part of that decision. So I think with Medicare, your big consideration is, would it be financially a better decision to go on Medicare instead of staying on your employer group health if you're going to continue working? And often we find that Medicare provides better coverage with a lower cost than most people's employer group health plans.
Wow, that's interesting. I don't think that's what people think, so that's interesting. Medicare can feel very confusing for a whole lot of reasons. What are the top misconceptions that you see about Medicare?
Oh, good. Yeah, that's a good one too. So I would say that as opposed to misconceptions, I see a lot of lack of knowledge. And it's because we all work and we have our health care through our employers. We kind of adjust our situations to work with the coverage we're provided. And so we get to Medicare and you're 64 and a half and suddenly you're flooded with information. Now you get to make all the decisions, and that can be really daunting because you don't want to mess things up. It is decisions. You may make a decision that you hold on to for the rest of your life. And so it is an important time to consider your healthcare and really invest some time in it. So I think it's just having someone to help you navigate the information that's out there.
Right. And that's where an expert like you comes in. So let's say that someone is turning 65, but they don't want to retire yet. How do they decide when to start Medicare?
Well, I would say the first consideration is the size of your company, because you're required to take your Medicare if your employer has fewer than 20 employees. So if you work for a small business, what happens is at 65, you can continue your employer group health care, but your Medicare becomes your primary source of insurance, health insurance. If you work for a larger organization, then you get to make some choices. None of us have a crystal ball. We don't know what the next year is going to bring health-wise. But what you can look at is your past history. And so a lot of times it's a good idea to kind of list all the health things that have happened in the last year, or maybe if you had a bad year a couple of years ago, and say, okay, if I had been on Medicare, what would it have costed me there as opposed to being on my employer group health plan? And sometimes just that cost analysis can help you make the decision.
Yeah, no, that's really good advice. So some people may be wondering whether they have to take their Medicare and Social Security at the same time.
Right. You do not have to do that. And many people start their Medicare at 65 and they wait for their Social Security. Social Security is actually they administrate the Medicare program. So you do that through Social Security. And if you set up an online account with Social Security, one of the neat things there is a Social Security calculator. It shows you how much you would make if you take your Social Security early or if you wait. So it's a nice tool that's on their website, and you say, hey, how do I want to do this? And I had a financial advisor tell me once, Social Security is a non-inheritable asset. So if you're living on your salary, then there's no reason perhaps to take your Social Security. If you're living on retirement income that you could pass along to your loved ones, perhaps you want to consider looking at taking your Social Security.
Good advice. So what's the difference between a Medicare supplement and a Medicare Advantage plan?
Great question. I get asked that every day. So really, Medicare is good insurance, but it has some gaps. So first of all, there's no drug coverage. Medicare has hospital coverage. It has medical coverage, But Medicare expects you to work with the private companies to get your drug coverage. And Medicare also is set up 80-20. And so they pay 80%, you pay 20%. There are also some deductibles. And so what you can do is structure some additional coverage to cover that 20% gap and to cover those deductibles. So those two different routes are the two you just mentioned, either a Medicare supplement or a Medicare Advantage plan. The Medicare supplement works with traditional Medicare, and it has a monthly premium. So what that means is you're going to pay for your health care in advance. And that coverage will cover all or part of that additional amount that isn't covered by traditional Medicare. But because it only works with traditional Medicare, it doesn't have any drug coverage. So in addition to a Medicare supplement, you also need a prescription drug plan to cover your medications. Now, with the Medicare supplement, back to that, there's no network. So with that, since you're working with traditional Medicare, you can go to any provider who provides Medicare services. And as long as any kind of service you get is covered by Medicare, that supplement will cover all or part of the difference. Now, so that's how a supplement works. How an Advantage plan works, it is, Medicare is actually giving some of the money to the private healthcare company, and the private healthcare company then manages your healthcare. So it's an all-in-one plan. It has your hospital coverage, your medical coverage, your drug coverage, and it offers some additional benefits like dental and vision, things that it's nice to have some coverage. Hearing coverage is also something a lot of seniors like to see. And so all of those things are included within the plan. These plans are network-based, and that means that you have to go to hospitals and doctors who are in the network. So that is a consideration when we put the puzzle together to make sure that you have the plan that works best for you.
Right. Good. Now, how do consumers avoid penalties when it comes to Medicare?
That may be people's biggest fear when they get to Medicare. Oh my gosh, that I'm going to end up with a penalty. And you can, and I've seen some rough situations. So it's good to be informed regarding the penalties. The first is Medicare tells you don't have to get prescription drugs coverage. And a lot of people aren't taking any medications when they turn 65. But if you don't get coverage at 65 and you try to get it later, they will penalize you for every month where you didn't have drug coverage. So it's important to make sure that you have some drug coverage from the time that you sign up for Medicare. And a second penalty is if you don't have creditable coverage through your employer or however you're receiving your coverage, and you later sign up for Medicare, they will penalize you for the months that you didn't have creditable coverage. So that is something, if that concerns you, talk to your HR department. It's a good thing not to assume, but to make sure that your coverage is creditable coverage, that it's at least as good as Medicare.
Great. So let's shift gears for a minute and talk about optimizing Medicare coverage. So when can someone change their plan, and when does it make sense for them to do that?
Well, you can. The fall is a good time to look at plans. And the two types of plans you can only change in the fall unless you have special circumstances. Those would be Advantage plans and prescription drug plans. So both of those types of plans have to be changed in the fall from October 15th to December 7th. That's called the annual enrollment period. And that's when we see lots of advertisements on TV, on the radio, on sides of buses, on billboards. It seems like they're everywhere, and a whole lot of mail goes out. So I think that those who are on Medicare will be well informed that it is the annual enrollment period. So during that time, with an Advantage plan, you can make a change from year to year. Maybe you have a doctor who's no longer in network with your plan, so you want to make a change. Maybe they aren't paying for your prescriptions well, and we want to look at making a change. Some people, they have been on a supplement. It has that monthly premium, and their costs have gone up and up, and they want to see if it would be more cost effective for them to go on an Advantage plan. That's another thing that we see. So we love to sit down with folks talk through what their prescriptions are, what doctors they see, and what kind of coverage they're the most comfortable with. And then we can help them make a good decision going forward with their coverage.
Now, a huge topic for older Americans is prescription costs. How can people save money on their medications?
Yeah, boy, that's like its own bill every month. It's almost like a utility, paying for your prescriptions each month. And so it is good to be savvy, to be a savvy consumer about your prescriptions. So the first thing I would say is year by year, it's good to check your prescription drug coverage. Some people get on a drug plan when they turn 65 and they never look at it again. But your prescriptions change each year. The drug companies change the premiums for plans. They change their formularies, the list of the drugs that are covered. And so you may see a big jump in your costs from one year to the next where you didn't even have a change in your drug list. So it's good to check your plan, but there are other ways to save money. One of those is to make sure that your doctor is prescribing generic medications, if that works for you. I mean, obviously, I am not a pharmacist, I'm not a doctor, but if you're able to take generic medications, the cost is much, much lower than it is for name brand medications. A second way is to make sure that you're going to a preferred pharmacy. So you want to go to a pharmacy that your costs are lower than it would be if you go to another pharmacy down the road. And you want to make sure that pharmacy is in network. And the third thing would be sometimes it's better not to use your drug plan at all and to go outside the plan with the pharmacy discount programs that are available. I think a lot of people have heard of GoodRx. And through GoodRx, you can actually go outside the system. It kind of works like Travelocity does for travel, where they make agreements with the different pharmacies. And so you go to your pharmacy that you've used. But if they work with GoodRx, you pay cash for your prescriptions. And often that can save you a good amount of money.
That's great. This is super helpful. So let's bring in a question from our audience. And you touched on this earlier, but this is a real specific question from a reader. So on Medicare, am I limited on the doctors I can choose?
Well, I would say yes, because some doctors don't accept Medicare. Obviously, a pediatrician doesn't take Medicare, right? They're seeing kids. So you need to make sure that your provider or your hospital accepts Medicare. Secondly, that they're accepting new patients. So for anybody who has Medicare, that pertains. Then it depends on the different type of product you have for your additional coverage. With a Medicare supplement, you do not have to, you don't have to work with a network of providers. So you can go to anyone who provides Medicare services. But if you have an Advantage plan, those do have more specific guidelines because they've contracted with certain providers. And so you do have to make sure with those plans that your provider is in network. So with a Medicare Advantage plan, you usually don't have much of a cost on a monthly basis. That type of coverage is pay as you go. So it's a plan that has copays, and it may have some deductibles involved. But they're limited. And the great thing is all of those plans have a maximum out of pocket. That means that there are only so much you will pay in copay amounts through the year. And after that, the insurance company is going to cover the rest of your costs for the year. But the supplement, you pay a monthly premium, and you do with that separate prescription drug plan that you have alongside the supplement. With the Advantage plan, you have a low or no premium. A lot of them are $0 plans, but with that, you have copays for the services that you have through the year.
That's great. Well, Kate, thank you so much for joining us today. This has been interesting and really, really helpful information. So thank you so much.
Thank you, Jana.
Next, we'll be talking about living with chronic diseases with Dr. David de la Peña of Kettering Health. Dr. de la Peña is an internist serving the greater Dayton area, and he practices primary care for Kettering Health. He's also a fan of reading, traveling, and Jeopardy. Hi, Dr. De La Pena. It's so good to have you on this edition of In Your Prime.
Thank you for having me.
As we get older, even as we're living our best lives, we may find that we're managing a persistent, long-lasting condition that's not easily resolved. I know one of the things you consider as a physician is that we can't just treat the body for these diseases. We also have to treat the mind and the spirit. So define chronic disease for us and tell us a little bit about your approach to helping patients.
So as a physician, I encounter chronic disease every day. And one of the things that is forefront when I talk to a patient is finding out how far along this chronic disease is progressing and how much it has affected other areas of their lives, whether that's social interactions and their mental health and things like that.
Great. So according to the CDC, 6 in 10 Americans has a chronic disease and 4 in 10 have 2 or more chronic diseases that they're managing at the same time. What are the most important things for someone to consider when they've been diagnosed with a chronic disease?
Sure. One of the things that I consider and I'm interested to find out is among those diseases, where do they intersect? What things do they kind of have in common? Because those become important parts of treatment later on.
Great. Now, can a chronic disease diagnosis be reversed?
So the bad news is no, not reverse in the sense that it ever goes away. But the good news is that there's ample opportunity to be able to control a chronic disease, keep it from progressing, and even getting to a point where you can do so using fewer, if not minimally, medications as possible.
Well, I'm glad you brought up medication. So what should someone look for when they're choosing medication to manage a chronic disease?
Sure. There are some diseases, like I said before, where things intersect. And so, for example, if you were looking at chronic kidney disease and looking at conditions like diabetes or heart failure, there are some medications that can benefit all of those conditions at once. And so trying to find avenues in which you can hit 2 birds with 1 stone is something that I try to like to do as much as possible.
Right. Now, so many medications today, they come with all these disclosures of all the potential side effects that the medication could cause, and they can seem really, really scary. How worried should someone be about the side effects of these medications when they have a chronic disease? And, just kind of help us put that into perspective.
Sure. And this is actually one of my favorite questions. I get this just about every day in the office. But best illustrated by an example. If I go out to a burger joint and I eat a bad burger, and I happen to be in a trial studying the safety of a particular medication, no matter if it's to grow more hair or get rid of something inconsequential, and I end up getting sick to my stomach the next morning, that I will have to report to whoever is studying this drug as a potential side effect. And so some of the things to consider are that some of those side effects that you read may not be due to the drug, but for other sets of circumstances. Another example would be diabetic medications, in which some of them have a warning about threatened limbs and things like that. But when you look at diabetic patients as a whole, that is a fairly common problem, compared to the rest of the population. And so trying to keep those associations straight becomes troublesome. Now, should people completely discount them? No, but it should definitely be a conversation between you and your doctor.
Great. That's really helpful. Now, our readers are really very interested in this topic, so let's get to one of their questions. So, what is the most important thing a person can do to keep healthy?
By far and away, the conversation I have with my patients involves diet. It sounds a little cliched, maybe trite, but there's a reason why we harp on what we eat. There's a quote of, let food be thy medicine. And a lot of the problems that we run into with our health are somewhat consequence of our day-to-day, feeding of our bodies. So what I would suggest is try to find small improvements, little areas here and there that are easily attainable, and try to work on those things, whether it's cutting out, an extra treat during the week, or, decreasing the size of your plate and things like that to try and help.
Great. That is super helpful. Now, as we said at the beginning of this segment, managing a chronic disease is more than just medication and doctor visits. A chronic disease can affect a person's lifestyle, their mental health, their relationships. Do you have any final messages of hope or advice for someone who's facing this kind of diagnosis?
Sure. With the people around you, I think it's important to surround people who will support you and understand where you are coming from, and try to meet you halfway. It is not some of these chronic diseases with medicine where we're at today, not necessarily a death sentence or anything around close to that neighborhood. But finding physicians, friends, family who will support you along the way, you will be able to do it.
So I'm sure that getting a diagnosis of a chronic disease can be a really overwhelming thing for people. How do you help them get through that to acceptance and to moving on with their treatment?
Sure, that's an excellent question. Sometimes my patients come in and, as you say, they are overwhelmed. They suddenly might walk out of the office with an entirely new list of a couple of medications that they, incorporate into their daily routines. Maybe that means, having to change their day-to-day to include things like injections, and so on and so forth. All of that can be overwhelming. One of the things that I always kind of try to impress to my patients is Rome wasn't built in a day, and how do you eat an elephant, as a mentor told me, one bite at a time. And so trying to incorporate, small changes over time, it is a lot more helpful, and I think a lot easier to process than all of a sudden, you have to weigh yourself every day and check your blood sugar and a bunch of other things. And so if we can work on a few goals at a time instead of trying to orchestrate a whole new lifestyle overnight, that is a lot more achievable, in my experience.
Is there anything else you'd like to add?
I think maybe last thoughts would be to just share with us, your physicians, people who are trying to take care of you and join you in this partnership. Because we do care, and we obviously want you to be healthier.
Thank you so much for joining us today. I know our viewers have learned a lot, and thank you for sharing your insights and your expertise.
Thank you for having me.
Thank you so much for joining us today. We are in the prime of our lives, and we want our lives to be the best they can be. Thank you to our sponsors, Ask Rafi Retirement Lifestyle Solutions, Kettering Health, and Medicare Resource Center. Our sponsors make it possible to bring you this important and timely information. Join us November 10th for the next event in our In Your Prime speaker series. And visit our website for more information on these subjects and so much more to help you make the most of living in your prime.